All right, we've all talked for years about the oral-systemic link, right? That connection between the mouth and the rest of the body. But how solid is the evidence really? Well, today we're going to dive into a landmark review that gives us the clearest, most definitive answer we've ever had.
So it all boils down to this one question. Is the mouth really a window to our overall health? It's something we've felt in our gut as clinicians for decades, but now we've moved beyond suspicion. We have the highest level of evidence to prove it, and it comes from one massive piece of research.
Okay, so here's the source for this explainer. It's a paper from Nature Communications published in 2022 called An Umbrella Review of the Evidence Linking Oral Health and Systemic Non-Communicable Diseases. Now pay close attention to that term, umbrella review, because it's the whole key to why this is such a big deal, right?
Section 1. The mouth is the mirror. This research really reframes the whole conversation. The mouth isn't some separate island, it's a direct reflection of what's happening systemically. And they prove this using an incredibly powerful type of study.
So what in the world is an umbrella review? Well, think of the evidence pyramid. An umbrella review sits right at the very top. It doesn't just look at single studies, no. It collects all the systematic reviews and meta-analyses, which are already summaries of evidence, and then synthesizes them. For us as clinicians, this is an absolute game changer. It gives us that authoritative 30,000-foot view of everything.
So now, for Section 2, a landmark evidence review, and I'm not just throwing that word landmark around. The reason this paper is getting so much attention is because of its unbelievable scale. It's just massive. Get this. The researchers pulled together data from 293 different systematic reviews. Let that sink in. We're not talking about a handful of studies. This is a colossal library of existing research all brought together under one single powerful umbrella. And it gets even more detailed. Within those reviews, they looked at 855 different meta-analytic comparisons. You can think of these as specific head-to-head matchups, like periodontitis versus diabetes, or tooth loss versus cognitive decline. This gave them the power to map these connections with just incredible precision. And that brings us to Section 3, the two-way health street. So what did all this work actually find? Well, here's the absolute crucial takeaway. The connection between our mouths and our bodies, it's not a one-way path. It is, without a doubt, a two-way street.
So let's look at the traffic flowing in one direction first, how the body affects the mouth. The evidence here is just overwhelming. We see patients with diabetes mellitus and their risk for periodontitis goes way up, or patients with depression who have a higher likelihood of caries and tooth loss. This just confirms what we see chairside every day. A patient's medical history is a direct and powerful risk factor for their oral health.
Okay, now let's look at the traffic going the other way, from the mouth to the body. And this is where the evidence is just as striking. The review confirmed that periodontitis isn't just a gum problem. It's significantly linked to cardiovascular disease, diabetes, and even things like dementia. And tooth loss? It's connected to cognitive decline and certain cancers. This is the ultimate proof that what happens in the mouth absolutely does not stay in the mouth. Now, any good clinician is probably asking, okay, but how good were the studies they included? And this is what I love about this paper. The authors were totally transparent. They used a tool called M*2 to grade the quality of every single one of those 293 reviews. And look at this. They found that over 70% were of critically low quality. They put the weaknesses of the existing literature right out there for everyone to see. That's good science.
So, does that mean we just toss all this out? Not at all. And here's why. The authors ran a special statistical test, a fail-safe number analysis. It basically asks, how many unpublished studies with negative results would have to be hiding in a file drawer somewhere to make these connections disappear? And for almost all of these links, the answer was an astronomically high number. The takeaway? Even with the quality issues, the evidence is so strong it's almost certainly not going to change. These connections are rock solid.
So that brings us to the most important part. Section 4, from science to chairside. This is the so what moment. What do we do with all this powerful information in our practices, with our patients? How do we translate it?
Well, the paper lays out a really clear three-step action plan. First, we have to actively identify patients who are at risk by really digging into their medical histories. Second, we need to integrate these conversations into our everyday practice. We have to be the ones to connect the dots for them between their systemic and oral health. And third, we have to educate our patients on this two-way street, using the power of this evidence to show them why their oral care is a vital part of their overall wellness.
And let's be clear, this brings us to a new era of care. Following these steps isn't just about making a few small tweaks. It's about a fundamental shift in how we see our role, moving dentistry right into the center of the broader healthcare world.
In fact, the authors themselves said it perfectly. Their goal, they wrote, is to contribute to a global view of health with the mouth as an integral part of the body. I mean, that's it right there. It's a call to action for all of us to break down the old silos and become true partners in our patients' total health journey.
So I'll leave you with this one question to think about. Armed with this level of definitive evidence, how is this going to change the way you practice? How will it change the conversations you have and the treatment you plan when you walk into the office on Monday? The evidence is in. The science is clear. The next step is ours.